Leprosy by Natalie Chase, Michaela, and Cohen. What is the history of this disease? Where was it first discovered? The first recorded case of leprosy, according to the Egyptian papyrus document written, was around 1550 BC. The leprosy disease was thought to be a hereditary disease, a curse or a punishment from a god for a long time. In Europe during the Middle Ages, leprosy sufferers had to wear special clothing such as bells to warn others that they were close. Okay. What are the symptoms of the disease? How is it diagnosed? Symptoms are disfiguring skin sores, lumps, or bumps that do not go away after several weeks or months. It affects the skin and nerves outside the brain and spinal cord. Leprosy is diagnosed by taking a skin biopsy, which is when the doctor removes a small sample of the abnormal skin. Also, leprosy can be diagnosed by taking a skin smear test.
Keep going.
About 180,000 people worldwide are affected with leprosy, mostly in Africa and Asia. At least 3 million people are living with some sort of permanent disability due to leprosy. Men are twice as likely to contract leprosy as women. One child is diagnosed with leprosy every 20 minutes. Leprosy is known as the Hansen disease, named after a physician named Grahara Hansen.
What is the prognosis for the patient? It depends on the stage of leprosy. Skin discoloration and damage happens even after treatment. They use MDT to cure it. It is curable.
How does the person contract the disease? A person gets this from bacterium traveling from person to person. When someone with leprosy coughs or sneezes, it can transfer to you easily. It's not highly contagious like everyone thinks.
How can the disease be treated or cured? It is treatable by a medical professional. Leprosy is curable disease using MDT, multi-drug therapy. Long-term treatment cures the disease and prevents complications if it starts in early stage.
How can the disease be prevented? Are there vaccines or antibiotics? There are no medicines or vaccines to prevent this disease. Main way to prevent is community awareness, to know who has it. It is contagious, so the best way to prevent is to stay away from those who have it.
What is the future of this disease? Are we likely to ever cure it? Is the disease useful in some other way? The goal is to cure leprosy, and it is possible. In 1991, a goal was set to eradicate any significant amounts of leprosy in countries of the Western Pacific, and they have been successful.
Now let's ask some questions for the audience. What is another name for leprosy? Yes, in the back. That's right.
Something Hansen.
Yeah, the Hansen disease. True or false? It affects nerves outside of the brain. That's right. True or false? Leprosy is curable.
True.
Are there medicines to prevent the disease?
No.
Who is more likely to get leprosy, men or women?
Men. Yay! Good job, you guys. I hope they didn't catch you up. Oh my goodness. Stop the broadcast. How do you say that name?